things better. Today, I have Lieutenant Schwartz with me,
Hello.
and she's going to say some awesome stuff that the TOPA office is doing. I hear they have this new program called Right Start where they have you in mind when they make it. So, Lieutenant Schwartz, what are some of these rumors I'm hearing that you care about the patients and you want to make sure you do everything for them? Not everything for them, but, think of them.
Yes, help them out.
Yeah, help them out.
So what we do with our Medical Right Start is we create custom folders for each patient. So when they arrive here at the Med Group for Medical Right Start, they get customized folders, and the most important piece of that is that we give them a personalized IMR checklist. So everything is highlighted for them as far as where they need to visit, so that way when they come here for Medical Right Start and when they leave, they're green, which is our overall goal.
So, how cool is that they're actually thinking before you get here what you will need to do to make sure your transition's smooth? So, hey.
Hi everybody, do you remember me from the last video? I did the bird flaps and got Sergeant Cervantes to go see the rock climbing. Hey everybody, have you been to the med clinic recently and seen these trailers outside? Wondered what's going on and if it's impacting you? Well, I'm here with Sergeant Cervantes to explain what's going on.
So what we're going to be doing over the next 2.5 to 3 years is modernizing our facility. What we're going to be doing is moving some of the sections around. We're going to be upgrading the pharmacy, family practice, pediatrics, PharMC and BOMC departments. And we're going to be adding in equipment and improving care for you.
Guys, what they're doing here is amazing. They're making everything look pristine, they're improving the quality of service, and just making everything better for you. So if you have questions about how these changes are going to impact you, then just look at the link below.
Okay, everybody, something everybody gets to do is behind the scenes in the dental clinic. Now, you're doing things to keep me and active duty members less time in the dental chair and more time in the field. So I hear that there's other equipment to help us do that as well. Is that correct?
Absolutely. So to get to that 3D model in your hand, rather than having the big tray of goop that gets thrown in your mouth and you have to sit there and you can't breathe, gross, we basically have this 3D camera that's like a magic wand that we wave around, and it captures an image that we can then translate to this printer for printing it out, which saves time. Same deal with crowns. We have this little robot machine that has burrs that spin around to mill out restorations, so we don't have to wait several weeks for the lab to turn around like in days of old.
So now that your chompers are good to go, how about we feed our soul with some soul food at the Fellowship Luncheon February 11th at 11 or 12. But last but not least, the bowling alley snack bar is now open for business.
Hey everybody, we're here for one last stop at physical therapy with Captain Walter.
Woohoo!
And so I hear that y'all have been going out a few times to other units to provide services for them when they're not able to get to you. So what can you tell us about it?
Yeah, that's pretty much it. So, Aaron Williams, have you ever ordered some food from a restaurant and you're like, man, I just don't even want to go there, and you're like, oh wow, there's an app for it, I'll just order it online.
Best part of my life.
Yeah, isn't that great?
Yeah.
Well, it's not like that for physical therapy, but physical therapy sometimes will come to you. Now, there's only one of me. I wish I could clone me and come out to everybody, but that's just not the case. But we try to come out to some high utilizing units, usually the units that are lifting heavy, the ones that are flying, things like that. So we try to do our best to see if we can prevent injuries. But not only do we do that, but we also treat and evaluate. So the same thing that we do in here, we can do at the unit. So we bring some tables, we bring our hands, we bring some needles, and we can treat the patient on the spot. So there's no need for a referral, there's no need to wait in line, we just see them right there and then.
That's awesome. That's really awesome. Not having to wait in line, not having to travel here, out in the
No
cold.
one likes waiting in line.
I don't want to come out in the snow.
No.
So that's really awesome. So if you ever see them, stop by and make sure you talk to your leadership and get an appointment with them when they come to your unit.
Sounds great.